Hello and welcome. This is Trevor Crow. The show is Trevor and Friends. I'm going to start with my word of the day today, Melorism, which is the philosophy. Oh my goodness, people, I can't speak today. The belief that the world can be improved through human effort and action. The world can be improved by human effort and action. And the reason why I am thinking about this word at this moment, I'm having a little trouble speaking, is because next to me is Dita Bhargava. She is a parent advocate, attending the Executive Master's Public Health program at Yale University. She's also a board member of Liberation Programs, part of the United Way. And Dita has quite a bit to talk about when it comes to addiction, overdose treatment, etc. So welcome, Dita.
Thank you, Trevor. Thank you so much for having me. And Melorism, I love it. I've never heard that before, and I'm honored you're using it at this point with me on the show. Thank you for doing this. This is an incredibly important topic. I believe we're talking about substance use disorder and mental health disorder, which is unfortunately an epidemic in our country, as you know.
It is a huge problem, and it's touched you personally in your family. Can you tell us a bit about that?
Yeah, so unfortunately, yes, it touched us deeply. So our eldest son, Alec Pelletier, suffered from substance use disorder and mental health disorder. He had a mild bipolar condition, which was diagnosed late in life. But as a younger child, he suffered from depression. He started self-medicating with all too available painkillers, and that's a whole topic in itself. But just a void of sort of responsibility from pharmaceuticals, but also the government. And so, like many others, he started using painkillers. And then moved on to harder drugs. Our biggest fear was, of course, that we could not get him on a permanent path to recovery before the scourge of fentanyl in our country, which is another just whole topic in itself, and another sort of gaps in government. And we couldn't protect our children from big pharma. We couldn't protect our kids from fentanyl, my son, and a million others since the painkillers started being distributed in the 1990s have died since then.
Unbelievable. Yes. The numbers are overwhelming, and it is a public health crisis.
Yes.
Still to this day.
Right.
Now, there has been some glimmers of hope along the way. Our overdose rate has declined quite rapidly since Narcan has been available. Could you talk a little bit about what Narcan does and why fatal overdoses have come down?
Yeah, so thank you for bringing up that fact that overdose rates have come down, but also the fact that it is almost 100% related to the fact that we have had widespread harm reduction methods. And Narcan, or the more technical term naloxone, is a reversal. It's a medicine that can reverse an overdose. But in our son's case, Alec's case, who, by the way, wanted nothing more than to be on a permanent path to recovery, he was completely dedicated to getting there, and he was on his way. He was doing tremendously well. This is often the case, that people are doing tremendously well, and then they relapse. Yes. Their defenses are down. It was on his birthday, actually, his 26th birthday.
Goodness, Dita.
And he had a tough, day, night. The second voice in his head that said, just one more time, won that day, but he didn't, and he couldn't survive. And so many people pass away this way. But Alec had carefully placed 2 packages of Narcan in his bedroom, one right by his bedside. And there were young men, he was living in a sober living home, who were right outside of his room, who didn't know that he was in trouble and had relapsed. Narcan can't work if someone is not there to administer it.
You need a second person to administer it.
Correct.
The person who is overdosing in the moment cannot give it to themselves.
They cannot. And so, unfortunately, as much as he was careful and didn't want to die, he was found unconscious, actually not breathing, when they finally discovered that he had used again, and no one, and it was shame and stigma that prevented Alec from seeking the help.
Yes. And that is a big thing, and we all have to step away from the shame and really think about what addiction is about. In fact, I love a quote that you put in an article that I read, which is, addiction is the opposite of connectedness.
Correct.
And
Yeah,
this is
absolutely.
where, when we can show all of our people deep love, deep support, we're not shaming them, and we're saying to them, we can help you, we can understand you, and there are paths to treatment and recovery.
100%. Recovery is real, and connection is definitely the opposite of addiction, which is highly correlated to loneliness. And that's why, there are a lot of, it's a multi-pronged approach to mitigating this crisis in our country. One of them, of course, is harm reduction, but also we need people to connect, through peer support, through looking at addiction with existing disorders.
Yes. Huge.
And finding those integrated methods of helping and diagnoses. So that all falls in line with prevention as well. Recognizing when a child is in trouble, educating teachers and schools. That's all part of prevention. So we need the prevention, we need the treatment, we need the recovery, we need work in all three pillars.
And I'm sure most of you know, I am a licensed marriage and family therapist, and I see a lot of addiction throughout my families. And in fact, this very, very, very similar situation has touched members of my family as well.
Absolutely.
So I fully, completely understand this, and it's truly incredibly sad, but at the same time, what you're doing is you're saying there is hope. There are paths to treatment and recovery, and kind of back to the original word of this podcast or radio show today is Melorism, which is we can do better. We can help people through that clear effort, through love, through kindness and compassion. I truly believe that. So, Dita, you're doing that for our community right now. Anybody who's tuning in right now, I am discussing opioid addiction, what we can do, how we solve it. Dita Bhargava is a parent advocate, and she's also advocating to get some laws passed in the state of Connecticut. And this is very interesting. Talk to me about SB 7. There's a very long name, which I think takes a little long to say on the radio, but what is exactly SB 7? Why is it important?
So SB 7 was a bill, it was a public health bill, it's a Senate bill that was introduced into our state legislation this term. So back, in May is when we had it had passed in the Senate. The bill itself was a large public health bill that addressed many public health issues in the state of Connecticut, including substance use disorder, specifically overdose. Because as much as we have put out the Narcan, as much as we have treatment centers, we have funding, the rates are not really falling as fast as they could. They have fallen because of harm reduction, but I'm sorry, 1,000 people dying each year, it's not acceptable.
Are you saying 1,000 people die in the state of Connecticut through lethal overdose or accidental overdose every year? 1,000 people.
Every year in our state, 1,000 people pass away because of overdose. And those are preventable deaths.
Wow.
Trevor, since my son passed away in 2018, our son, like I said, passed away on his 26th birthday. Over 7,000 people have passed since then. And that's the real tragedy. My story is one of so many across this state, across our country. So SB 7 would have introduced the allowance of overdose prevention centers to exist in our state.
Overdose prevention centers. Okay, anybody tuning in, this is one means for preventing lethal overdoses, but you have to describe to everybody, what does an overdose prevention center do? Why does it help? And is there actual research and time for us to know that they actually work?
Great questions, Trevor. So there is over 20 years of research and proof that overdose prevention centers work. Last year, I had the privilege of traveling around Canada with liberation programs, nonprofit that I sit on the board of, which is a great organization that people can turn to if they are in trouble. And we'll talk about that later. But we traveled around Canada and looked at different overdose prevention centers where they have existed for over 20 years. There have been something like over 50,000 people who have walked in through these centers over the last couple of decades. Not a single person has passed away.
50,000 people in Canada over, I believe it's 3 to 4 centers throughout the country.
Yep.
50,000 people have been walked through these centers, lived through it, so not a single death.
Yep.
And many of them actually started their real true road to recovery.
Well, that's a great point. So not only is this center a place where, like in our son's case, if he had a place to go that night when he was in trouble, when he didn't want to be judged, he was ashamed, he would have found his way there because he didn't want to die, and that overdose would have been reversed with naloxone, he would be here today on the road of recovery. And I can say that for so many people because we have seen it in Canada. We've now seen it in New York State for the last 4 years. Rhode Island has opened up a center. Vermont has just passed a bill to open up a center. Our state is surrounded by states who are taking this initiative because they're taking lives seriously. The sanctity of life is taken seriously. And the only thing I feel that prevents us from doing this in the state of Connecticut is stigma, ignorance, you know, and not valuing these people's lives and not seeing that they have a disease, just like you would give them radiation for cancer or chemotherapy. You're giving them a medicine that's going to keep them alive. And then to your point, it's a community center. We said the opposite of addiction is connection. These centers not only can save a life, that's a small part of it. They connect people to services, to jobs, to schooling, to other medical help, which has gone, you know, neglected for a long time for many people. So it's really just a way to create healthier living for our communities.
So I personally love this idea, but I know there are many out there who do not. So what are the arguments against it?
Great question, Trevor. I think, you know, there are several, but the main argument is that somehow we are going to encourage people to use if we have these centers where their life can be saved. My argument to that is, well, we've done such a great job, bipartisan effort to get naloxone out into our communities.
We have.
And the same rationale applies to naloxone that does to overdose prevention centers. What good is naloxone if nobody is there to administer it? But you could say, well, it might give somebody the encouragement because they have naloxone sitting next to them. That's not how addiction works. There are decades and decades of research that show that addiction is not a consequence of enabling. It's a disease. It's a rewiring in the brain. And so to punish someone and saying, you are not allowed to live another day because, you know, we're not going to allow healthcare workers to help you out in your sickness, in your gravest moment of need. That is pure stigma and ignorance.
It is.
There's also this idea that somehow if you have these centers in your communities, that is going to create crime. There will be, you know, paraphernalia. It's actually the opposite is true.
Interesting.
Because now you have, and again, these are studies based in Vancouver. Now you have these people who normally would be using on the streets with, you know, syringes and with, you know, pipes and everything else. Now they're coming into a safe place. So those things are off the street, and they're off the street, and they're being given help. So they're going to go back out there, hopefully, and be, you know, more constructive and, you know, healthy citizens of our community.
Well, some of the numbers that I was reading that I was most encouraged by, I guess is the right word, is once these people have gone through one of these treatment centers, their chances of recovery are far greater, like by double digits.
Right.
Double digits.
100%. And it makes sense, right? Because now you're connected. A lot of people who suffer from substance use disorder feel like there is no other way to life. And they don't think that there are any answers. And now here they are in this loving, comforting center. And if you go to one of these places, I Senator Anwar, who
Love him.
yes, he's awesome.
Got to get him on the show.
Oh, he'll come. I'll make him come. I'll come with him. I'll come back.
That'd be awesome.
But he went to one of these centers and he literally started crying because he was so touched by what goes on. And I felt the same way when I went to these centers in Canada. They are doing tremendous work, mostly to make a person who is struggling, who is vulnerable, feel like their life matters.
Their life matters. And you know what? Of all the things, if I can say on my show to my clients, to my family members, the sense that you matter, that you're seen, that you're heard, that you're valued by your community, by your people, is what a real good, happy life is all about.
Correct. Yep.
And that goes back to our quote about addiction is the opposite of connectedness.
Correct. And I just want to add quickly that if you follow this bill, it passed through the Senate, and it was supposed to be heard in the House.
Okay.
And on the day it was supposed to be heard in the House, I actually had a conversation with Governor Lamont, and I have a lot of respect for him. He's done some great things for the state. He's a compassionate person.
He's done a great job.
He's the
Really
reason
has.
why naloxone is throughout our state. I had a conversation with him that day, and I explained to him why this is so important, why I feel like our son would be alive and thousands of other people in Connecticut. And he said, that makes sense, Dita. And unfortunately, that very day, he said he will not call the bill unless that specific piece of overdose prevention centers was removed.
And why is that?
You know, he said it's a wait and see. I don't really know, but apparently he said this to other reporters, that he wants to wait and see how this kind of plays out in Rhode Island. But we have over 20 years of proof. The wait and see, I'm sorry, Governor, the wait and see cost our child his life. And 7,000 people have died since Governor Lamont took office in 2019.
Oh, my goodness.
So we can't wait and see. Tell that to a family who stays up at night like we did, wondering if their child is still alive or if the fentanyl got to them.
Oh, my goodness. So just a reminder, 1,000 people die every year in the state of Connecticut. A full million Americans have died since the opioid crisis began back in the late 90s. This is a public health crisis.
Of epic scale.
And we do need to pass this bill. What is the next steps? What could we be doing? Anybody out there listening, Dita, tell them how they could support this bill, SB 7.
Please call. So the SB 7 has passed without this notion.
Oh, pardon me.
But we are going to reintroduce, Senator Anwar will reintroduce it with legislator Kristen McCarthy-Vahey, hopefully, and she's been tremendous support.
We will love Kristen McCarthy-Vahey.
Yes. And hopefully they'll call it again. I would love for the governor to call a special session because 2 to 3 people die every day in our state. And he needs to take that seriously, which he does, but he needs to take it more seriously. There's no reason why we shouldn't have these in Connecticut. We are a progressive state and we care about our people. Call your legislators. Call the governor's office.
Call your legislators.
Tell them that you value the lives in your community as much as any parent who is struggling trying to keep their child alive. This is important. We can save lives and we're not. And there's really no excuse for that. But they need to hear from you. So please call your legislators. Tell them that you support overdose prevention centers. Tell them that you support saving lives and giving people a second chance.
So we're going to wrap up the show in just a minute or so. Dita, do you want people to contact you, or is there any other than calling legislators?
Yes.
What would you suggest?
So, by the way, if anyone is struggling, 211, or you can call the SAMHSA hotline, 1-800-622-HELP. Liberation Programs, United Way of Connecticut. Those are organizations that I'm a part of, but there are so many. So look in your community. And yes, you can contact me. My email address is Dita, D-I-T-A, Bhargava, B-H-A-R-G-A-V-A-C-T dita@gmail.com. I'm happy to speak to you.
So today we've had Dita Bhargava on. This is Trevor Crow, Trevor and Friends. We've really had a very good, deep discussion on substance abuse disorder. Unfortunately, it is endemic. It's everywhere. All families are touched by this.
Mm-hmm.
This is a great idea to have these overdose prevention centers. If you're interested, I think everybody should be interested. Really contact your legislators. It's an important thing.
Yeah.
And do we have a minute or so? We have 2 minutes left before we have to go to the break. Dita, I actually have family members who have been revived by Narcan, when in fact 2 times. And they are
Thank
living,
goodness.
thank God, living really healthy, thriving lives today.
Right.
So I am a huge believer in treatment centers. I believe that we can do better, and I really appreciate the fact that you are out there fighting on behalf of these
And on
people.
that note, Trevor, the treatment centers is where a lot of parents fall short and don't know where to send their children when they're in trouble. There is a program called Atlas that Shatterproof, which is a nonprofit national organization, put out, and it's a great directory that will give you resources for evidence-based treatment centers. So please use that as a resource as well. But a great point about just chasing your tail. We did it for years, and it's the most frustrating thing for parents,
Yeah. One last thing here. I want everybody to have hope, really have a belief and faith that as a community we can come together and support these people who are really struggling. And the more they feel connected and supported and loved by us, the better they'll be.
Yes.
So we are going to wrap it up. We're going to go to a break. This is Trevor Crow. I'm actually supporting the show, so it's brought to you by Trevor Crow. This is WGCH 1490 AM. Thank you, Dita, for joining us today. Great show.
Pleasure.
We'll be right back after the break.